My name is Sheila Ryan. I'm an advanced nurse practitioner and I'm based down in Limerick. So I'm going to talk to you today about emollients and how to use them. So I don't have any special invested interest in any of the emollients that I'm going to talk about. So we'll press on. So what are emollients? So emollients is a global term. So it covers the leave-on moisturisers, the soap substitutes, the bath oils. And when you're kind of coming into dermatology for the first time or a skin clinic, we throw all these terms at you, and it's pretty dazzling, and like we'll change the names of things as well just to make it a little bit more confusing. So this is why these days are important. So and the other thing, when we're talking to you about what emollients you're using, the other thing that when you have to often come to a dermatology clinic, we start asking you, what are you washing with? And you say, gosh, they're going to ask me what I eat for breakfast next. But that's important to us as well. So soap is bad when you have eczema, because what that does is it strips whatever moisturizer you have out of your skin, so you'll need more emollients to use. So that's why we ask that question. So what it does, it improves the skin texture, promotes skin comfort, and that's really important when you're choosing the right moisturizer for you, because it should be giving you comfort. If it's not, it's time to look at another one. And it also then prepares the ground for other treatments such as topical steroids or tacrolimus or whatever else you need to use, okay? So when you're talking about emollients, it's a bit like when you get the garden shed. And if you leave that garden shed unpainted, it's going to be falling down next year. So you have to paint the shed. And that's the very same with your skin. You need, when you've got atopic eczema, you have to replace the moisturizer that's lost. The other way this theory was developed by Michael Cork, what he describes is, if you imagine when you've got the skin, if you're not atopic, your skin is like the concrete wall here. So you've got your moisturizer, natural moisturizing factors is your cement. However, when you've got eczema, your skin is like the Connemara wall. So things get in and irritate that wall and shake it up. And that's because of the lack of natural moisturizing factors in your skin. And so that's why when you've got atopic eczema, you'll find that lots of things irritate you. You mightn't be allergic to them, but lots of things irritate you. So by sealing your skin with moisturizers, you hope to kind of to prepare your eczema a little bit better, so that you're throwing off that irritant effect. So first thing, when you get your moisturizers, the first thing is, they come in tubs and they come in pumps, and you get tubes. If you're using the ones in the tub, you shouldn't be putting your hand into the tub to scoop out, because what happens is little bugs will grow after a while, and then you'll start getting infected eczema. So you want to be putting them out in a little container, especially the tubs. So scoop it out, and that's good practice. So have a little pot that you scoop it out into to put in, because when you're dipping into the tub, you will give a nice breathing ground for bugs and things. So if you don't want to do that, there's a lot of pumps in the market, a lot of tubes. The pumps can be a little bit tricky to start off with, because you often have to get them going. You have to give it a good old whoosh. So the tubes can be sometimes easier for people from that perspective. But that's something to consider. So then you've got the different types. So you have got creams. So they're lighter ones. You've got ointments, which would be the heavier base ones. And now we've got some gels as well. They're a little bit of cream and kind of the water base, so they feel a little bit different on the skin. And there's some new foams coming onto the market as well. as moisturizers. Now, I find the foam ones are useful for, you know, especially the teenage group or people that don't want any form of moisturizer. It's useful. They mightn't be as moisturizing as the others, but they do give you some moisturization, and it can be useful in different areas. And you've got the bath oils. So, other important thing, especially when you have atopic eczema, is when you're putting on your creams, because normally when we watch people putting on the creams, they all put them on like this. No, you have to put them on downward strokes. And that's because when you do this kind of action, you'll trap the creams in the hair follicles, and that gives you kind of folliculitis or spots, and they're quite sore. If any of you've had that folliculitis, it's quite sore. So downward strokes in the direction of the hairs, and you'll find actually once you get into the habit of that too, it's a lot quicker to do it. So it's, you know, downward strokes, put them on, and then get dressed. Because the other thing that with eczema is if you're leaving the cream soak in while you're doing that, you're doing a bit of scratching and you're whatever. So you need to cover the skin quickly afterwards because you want to kind of reduce down that time for scratching. That's important. So next thing then is when you're washing, soap avoidance is crucial. You want a lukewarm bath rather than hot. So if you go for a hot bath, it's like you're creating, I say to patients that I have, you're creating a motorway for the itch cells. Because when you think of it, when you go into a hot bath, what happens? Your skin goes red. It goes red because the blood vessels are dilating, and that gives you a real rush for your itch cells. So often patients will tell me when they go into a hot bath, they get the pain from the heat of the water distracts them for a few minutes, so they get a release. But when they come out of the bath, then it's vengeance time. So you want to get in the habit of lukewarm baths. And if you're somebody that gets itchy after your bath, then you should be putting your moisturizer on outside, you know, leave the bathroom. So don't be sealing in the heat of the bathroom. Do that in the bedroom so that you're letting the skin cool down for a few minutes and you're putting it on in the bedroom where it's cooler. Now for people who if you find it stings when you go into a bath or shower, what a good tip there is to put on some of your moisturizer before you go into the bath and let that wash off. So it's a little bit like when in the olden days when they were going swimming in the English Channel, they used to put themselves layers of goose fat, you know, to protect themselves against the water. It's the same kind of thing. So if you've sore areas when you're going into the shower or the bath that you're finding, you know, that's really stinging, that's putting you off, put a bit of your moisturizer on before you go in and then let that wash off and then put some more on afterwards. That's a good tip. So different shower options. So we have got Aveeno, they're out there, Elaf shower gel, Olatum shower gel, or you can use your you know, simple moisturizers like Silcox base in the shower as well. The advantage of these ones, if you're going into shared facilities, at least they look like what other people have, and at different stages of our life, that's important. So again, there's a good few bath oils in the market as well. You've got Aveeno again, and the Aveeno range is handy in that it's available in the supermarkets as well as the chemists, and sometimes you'll see that on sale. Real Life, they're new to the Irish market. Eucerin are doing a bath range as well, and Hydromol, a lot of dermatology departments are using it. It doesn't matter here which one you're using. No special preferences. You need to be using something. Another thing that's useful, and it's not a moisturizer, but I'm going to mention it, is Milton. Which any of you who haven't been exposed to Milton baths will say, gosh, she's really mad now. But we found that this kind of came from the States, that by using Milton in the bath, especially for children's eczema, where you're getting a lot of infected eczema, you were reducing down the amount of Staph aureus. So for people that are prone to infected eczema, Milton baths are useful. So it kind of, if you're talking an adult bath, it's 4 capsules in the adult bath, or a child's bath would be 2 capsules, or a baby bath, it's about 17 mils in your baby bath. Another product that does target infected eczema that's useful again is Emulsiderm. They're out here in the stands as well, and that one is useful too in the shower. It can be used in the shower, so it reduces down the amount of Staph aureus carriage. So what's the best moisturizer? They'll say whatever. It's the one that you like best and you'll use. That's as simple as it gets. It's all the one that you're going to use. So I'm going to go through a couple of them now. So aqueous cream, that was always designed as a soap, and especially when you have eczema, it's got an ingredient called sodium lauryl sulfate, which can irritate people with eczema. So it's not designed as a leave-on moisturizer for eczema. And people with eczema, if they complain of stinging, it's sometimes sodium lauryl sulfate. But it is on the medical card script. There's very few ones that are on the GMS scheme, and Silcox aqueous cream is one of those. There is a baby aqueous, which has excluded the sodium lauryl sulfate, which you can get. Then you've got Silcox Base. It has sodium lauryl sulfate, but it's not linked as much with the allergy potential, and that's on the GMS scheme, and that's widely used here in Ireland. You won't see that available abroad, so if you're looking abroad about comments about Silcox Base, it's not available over in the UK, so it's really only an Irish experience, but it works very well. Dipper Base, it's a pump dispenser. It's got a bit of a medicated smell, but it doesn't have any low on preservatives, so it's for people that think they have allergy, but quite pricey, 19 to 20 euros. Aveeno, they have a nice range. That's quite a light moisturizer, so it will be one of the lighter ones on the market. That's kind of it. Now, Epiderm and Hydromol, they're the same formulation. So they're the same mix, different providers. So in the Irish market, you've got Hydromol ointment and you've got Epiderm ointment. And you've got Epiderm cream. If you want, you can make the cream out of the ointment. So if you get some of the ointment, and because if you don't want to be getting both lots, and you add some hot water to it and turn it in, it'll turn into the cream. So just gradually add some hot water. That makes it into the cream version, and just store it in a container with a lid, so that can be done. But that's the cream version of it in the pump. For children, it makes a very nice bubble, the ointment version, and that can be really important because, as you know, with kids, you're going to be very limited as to bubble baths. So if you run that as the ointment as the bath is running, you get some nice bubbles. That's important. So that retails about 14 to 16 euros. So emulsifying ointment, again, this one is on the medical card. It's quite hard, waxy, so it's the only one we will say is stored in the hot press. Rather, everything else we say is stored in a cool environment. But if you want this to go on soft, store it in a warm area. That will make it kind of softer. It makes a very nice bath oil as well. So what you do is take a scoop of it and add some very hot water, hot to boiling, and turn it into a liquid, and then add it to your bath water as it's running, and you get a nice white foamy bath. careful getting in and out because the bath gets quite slippy, and you need to rinse the bath quite well afterwards because it can block the drains. So you need to make it a kind of a good rinse afterwards. But it's a nice, very luxurious bath. And it's on the GMS for scheme, and you can get 500 grams for €4 to €5. So it's well down thing. There's a softer version of it, Haldane's Base. It's €10, and it's not so easy to get, but it's, some of you may have had it. So that's kind of it. Paraffin gel, that's our, it's very, very greasy. It's, you know, it's like a real runny Vaseline. We would use that in where people have the, you know, if they're really very widespread eczema, and it's really hospital-based often, that they're generally under our care when we're using that. But it's where your skin is very sore. It's a real, you know, it's a nice one just as a rescue one, and that's about €10. That's kind of it. Now, when you're using this one as well, if you need to be careful if you're a smoker, because it's paraffin, so you can kind of it can happen, so be careful. But it is one that we will use in the hospital setting to rescue a lot of people. So that's one to use. Now these ones, I'm going to move on to some of the newer ones that you may not use. So these ones, both of these are gels, which are unusual. So they kind of feel a little bit different on the skin. So there is Addix, which has kind of some anti-itch properties in it, and double base. Now the double base is often, it's a nice attractive packaging for kids. It's, you know, sometimes we have to sell, there's a bit of a salesman things with when I'm trying to talk to kids about moisturisers. You have to jazz things up. So was in Crumlin they call the double base their Barbie cream. You know, so these are things that you need to have a think about as well. And urea-based creams are coming now into the Irish market as well. So we have a good few of them. So we have Eucerin and Relife and Range, and there's the other ones, the Uriage and the Keratosan. They're good for heels. So what they do is they will reduce down keratin. So if you've got a lot of scaling in the skin, they're very good at that. Ichthyosis, it's kind of a cousin of eczema. It's good, and they kind of increase hydration of the top layer of the skin. So they feel quite light, but they're good moisturizers. So if I've got somebody as well that actually they don't like the cream, the feeling of a cream, they feel that heavy. Often the urea-based creams, they are kind of often more lotion-based, so they give you that option there too. And saying that as well, you've got within those two, the urea-based ones, there's a spray from Eucerin, and there is a foam. So they're actually, they will give you some urea-based moisturizing, but in a real light texture. So if you've got somebody that absolutely doesn't want any of the creams or ointments, they're worth a look at. So, get some of those from the stands to try out today. So you also have then some of the physiological lipids. And all these companies, they have nice big long names as to what they do. But again, they act on the stratum corneum, which is your top layer, and they help restore the cells within that. So these are more advanced moisturizers than your traditional ones. So CeraVe is around a lot in the chemists, well, certainly where I am, that's about €12. You've got Relife range as well. They're new into the Irish market, and you've got La Roche-Posay, they would be quite available as well within the chemists. They feel lighter than your traditional creams, but they do work quite nicely. And you know, often you'll be getting away with less moisturization than you would from the older base creams. But you have to try and see what suits you. So what I say for kids, we have to make it fun. With children, I try and encourage them even very early on to play. So give them a small little bit of cream that they can play with. So they have we will encourage them to put the cream on Dolly, you know, and then we'll put them on you. Because I've had a lot of children over the years that can be they get quite afraid of it. And if you make it too much of a big deal, they're running. So getting the child involved from an early stage makes it easier as they grow older. So the same way as we would teach a child to brush their teeth, we should be teaching them to have a little bit of cream to play around with and introduce that sense of fun. And when I say kind of what I do with worms is I often will use the tube-based creams, and I'll squirt it in to the water like a tube, and you know, like a little snake, and I'll say, now can you catch the worm? So all these kind of tips will just encourage the child to play, and there's different things that you can do. So that's me, and I'm open now to questions. Yeah. Where we start? We'll start this side, and I'll work my way this way then, because otherwise I'll lose track. Okay.
Hi. We're about to go on holidays soon, and I think it's a very common question, like in terms of sun cream and how to manage that for kids.
Yes.
Any advice around that, or?
It's a good idea to try test your cream out beforehand. You know, so the best area to test any new product is here, the inside of the arm.
Okay.
So you draw a little mark there and put it on for a few days, the same as you would, you know, kind of there. So put it on for a few days and make sure that that's not reacting. So that's a good spot for any, especially if you've got an eczema child, as to what you're using, and because like there's a wide range of kind of sunscreens on the market now. Generally, the sunscreens, the only ones that we say for people to avoid are the ones that say they only need to be put on once daily. So your P20s, they will prevent UVB, which is the burning ray, but they don't prevent the skin cancer ray. So that kind of ones. But otherwise, generally we don't see too many reactions to the sunscreens. Nivea is quite low on preservatives. The Nivea Kids range is quite low, and I know La Roche-Posay do ones if you're looking for ones that are kind of low on thing there. But testing out here, I find is a good tip for.
Sorry, can I ask
Yep.
questions? I was just wondering, I've noticed like a lot of cotton and stuff around the place, and I would use cotton gloves sometimes at night time, or I'd turn my pajamas inside out, or things like that. I was just wondering if you have any kind of tips, because my gloves are gone in like 3 seconds, so I'm told that they're gone, and you know, once I fall asleep, then it's kind of all better off. I was just wondering if you had any thoughts or any tips.
Now there's a Snuggie. What age are you talking about? Oh, for yourself? Yeah, no, because there was a Snuggie one for kids that, you know, but there isn't for yourself. No, but you see, if you're putting your moisturizer on in that beginning bit, is you'll have enough of it. You'll be all right. You know that. Are you scratching at night? No. Yeah.
But I would moisturize, and I would.
Yeah. Keeping the bedroom cool is important.
Yeah.
And blankets more than duvet.
Okay.
Because what happens with the duvet is, because any of us does remember times before duvets, is the blankets, it takes you a while to get warm. So that while to get warm helps you with eczema, because that gives you your time to go to sleep. Whereas when you go into a duvet, you instantly heat up. So then once you heat up very quickly, you're scratching very quickly. Okay. So blankets are a tip from that perspective, that they keep your environment kind of cool is kind of useful, and kind of avoid kind of fussy furnishings like cushions and stuff like that. That's kind of like, and timber floors, if you have the choice, are better than you know, the carpet. And no pets in bedrooms. You can, like pets in the house, fair enough, but keep them out of the bedrooms.
Great, thanks a million.
Yeah.
To use,
because
currently I'm using the emulsifying ointment, but as you were saying, it's incredibly waxy, and I just avoid using it because it takes so long to get it out of the thing and spread it. And then also some of them would irritate and sting, like you know, the smallpox base even. So I don't even know now which one to try, because I'm afraid of something irritating me.
So same thing here. Like I find up here is a good time to test new ones, and there will be times when, if your eczema is flared, nothing is going to feel that comfortable, you know. So you have to be trying your new moisturizer out when you're kind of coming down off of a flare. So if you're somebody that's in the ointment version, like you are with the emulsifying ointment, get over that hump. You'll probably need a bit of topical steroids to settle you down, and then introduce a cream at that stage. Because sometimes it's just a case of your flare has happened for whatever reason, and if you're trying new creams at that stage, nothing feels comfortable, and you're blaming everything. You know, that's your kind of that. Because if you're cracked and sore, it's all going to feel uncomfortable. You know, that's where I'd be kind of mixing that and. Epiderm ointment might be a nice transfer for you, because it's softer, and that will get you into the cream-based range then, you know, as you get better. Because I know emulsifying ointment is it's hard to use as an all-over moisturizer. Nice as a bath oil, but I find it, and if you've localized areas, but hard as a general moisturizer to use. That's where I'd.
Thanks.
Yeah.
Chlorine. Should one use a barrier cream as protection?
If you find it stings you, yes, but before you set out to the pool, put on your moisturizer. So when you're at home, put on your moisturizer at home before you set out, and that will cover you in the pool. Yeah. But we know if your eczema is good. But if your eczema is good and it's not a problem, you're doing like a bleach bath, so it's not a problem. But if you find when you're in the pool, it's stinging you, no. If you're not, you don't need to do anything. But if you do find the pools are a problem, that's what you do. But if you don't find it, you're actually doing a little bit of bleach bath without knowing it. So you're doing okay. There was ones there at the back there. Yeah.
My son's 7 months.
Yep.
Also, it was a similar question. Do you shower him straight away after you get out of the pool to rinse the chlorine off?
You can do. Now, I wouldn't be worried if it's straight after. You know that yes, I'd kind of wash him down a little bit and put on a bit of moisturizer. But it's more if you can't shower him off, the moisturization there is more important than the showering off.
Okay. And sorry, just one more. At night time, you mentioned about the duvet, like you'd have a grow bag.
Yeah.
Should I switch to a lighter blanket? I do feel he gets very warm.
If he's getting very warm,
and he gets irritated, and then he starts going crazy,
no, switch
himself.
down lighter. Yeah,
okay,
lighter covering. Yeah,
okay,
yeah. It's over here. Yeah, Annie there.
Just for the urea-based creams, they're agonizing. So would it be okay, or could you use it with the emulsifying ointment?
You can, and you don't need to, as an eczema patient, you don't need to use the urea-based creams.
Oh, okay.
They're useful in ichthyosis, but, you know, that would be where, you know, they would have their strengths. But as an eczema patient, if you find them agonizing, leave them and just move on. Go to there's plenty of others, because the lipid ones might suit you better, or just the traditional creams, because they're useful in they're more useful in the scaling conditions. So the moisturizers should be there giving you comfort. If they're not, it's move on. There's plenty of others for you to go for, you know. And that's what's yeah, pretty much most people with eczema have a sensitivity to perfume, and so much so that even, especially if you're somebody that gets head and neck involvement, when people walk into Brown Thomas, they're like, you know, they walked in with no eczema, come out with that. Yeah, and I know in a lot of even scented candles and all the rest of it, that can all hit you. So yeah, you're avoiding perfume in your creams at the very least. Yeah.
We're transitioning. Hi, thanks. We're transitioning from a bath with oil at a minute, which we've been using since she was a baby.
Yeah.
And occasionally now she'd prefer to have a shower.
That's all right.
But I just find when she gets out of the bath after the oil atom, you know, even with the oil atom in the bath, if I don't kind of dry or pat her dry and put the moisturiser on quickly, she starts getting itchy. So I'm just a bit afraid of giving her a shower. I'm just have this fear of just pure water on her, that it's going to, she's just going to be really itchy.
That's where I suppose use something like Elav shower on, or Aveeno shower, to get something on. And if she's very kind of flared, I'd even put a light covering of your moisturizer before she steps into the shower, especially if she's, you know, bad eczema areas, just to kind of get her used to that.
Even before she gets into the bath, just cover her in epiderm cream.
But you know, because it is that kind of balance as to what's that. Now, when we always say, even when people are in their, you know, bad phases, be them adults or children, the baths are often better if you can, type thing is. But there is, there is a kind of a transition too that's important in different phases, that you have that option. But yeah, thanks. That works. Yeah. Oh yeah.
What would you recommend to put on her eyelids so that she's not actually rubbing her eyes thereafter and putting it in her eyes?
Yeah. Now, paraffin gel there actually works nicely, the real greasy one, because you want something that will stay in the area, or Vaseline, especially there. And is she using any active creams? Protopic works well there, tacrolimus.
No, like, I mean, most of the stuff that we're given, that we try with our GP, like, or even going to the chemist and ask for something. Yeah. The minute we put it on her eyes, she wants to rub it off.
Yeah,
so she's rubbing, and it's going on her eyeballs, and then she's screaming because it's stinging.
Yeah, that's where the paraffin gel works well, because even if you're getting it to her at nighttime, you know, she's sleeping, it'll soothe quite nicely. If it goes in a little bit, it's okay. It's not going to harm. It's not going to sting. But an active treatment for that is usually tacrolimus, or the trade name would have been Protopic, which will settle that down. What age did you say she was?
She's 2.5.
Yeah.
So she won't listen to, no.
Yeah, and you know, there what you can do is you can kind of play around with it. Is like, we'll put it on like lipstick and gloss, you know, this is kind of make the eye shiny type. There's a little bit of trade-off there, but it'll feel comfortable enough for her. There, that's kind of types that if you can kind of get her.
Great, thank you.
Yeah. Same. paraffin gel or Vaseline works very well on those areas. And again, if you need an active treatment, the Protopic that I was talking about works well in the ear. Protopic, yeah, that one needs to be prescribed, but that works. It's safe long term in the ear. You know, it's because sometimes with the cortisone works well, and if it's only a problem that's coming and going, the cortisone works well. The advantage of the Protopic is it's very safe long term. So, and if you're not getting a response with your cortisone, it's different. It's made differently. So it's what level of hydrocortisone are you using? Are you? Both of those are very safe. For an adult, you definitely need hydrocortisone, if not Humavate in the ear. Hydrocortisone is quite low in terms of strength for if you've got, and it's very safe to use long term in the ear if you know, because you won't do any damage there. Ceremal as well, actually, because we were just discussing this in the clinic. It's for earwax, but it's olive oil, so it's a safe one for if you need something down the ear as well. Yeah. No. But eczema psoriasis happens down the ear, and it's very distressing. I know it can drive you mad.
Hi, I just have a question on the folliculitis.
Yes.
I don't know how to pronounce it properly.
Yeah.
I never knew about the downward motion of the cream until now. So I have a daughter who's quite bad in her lower legs. Any advice how to treat?
Sorry, I got, you have a daughter.
She has that in her lower legs. She's lots of bumps and redness.
So that's what she's getting.
So how do I fix it now?
So what you need to do is, first of all, stop moisturizing that area. So you're only moisturizing where she needs it in the lower legs. So either the Emulsiderm or the Milton Bats then are a good way of settling down the staph aureus that's causing that. So you kind of avoid moisturization around those bumps. You let it settle. So either get Emulsiderm or the Milton Bats. What age is your daughter?
5.
So you're going to be the 2 capsules and the half bath, and Milton Bats twice to 3 times a week, nothing in it, and just settle it down that way. It will go, and it just takes a little bit of time. That's it type thing is, but it's that, and then once that's happened, then is avoid kind of. Just use the downward strokes. And when you're going back to your moisturizer, go back to a cream-based moisturizer. What one were you using?
I use Adex and Double Base.
That's fine, yeah. Either of those are okay type thing.
Thank you.
Yeah.
Can I just ask you for patients with varicose eczema, who would have open ulcers on their legs? I'm just thinking of the Milton, we've never used that.
Yeah.
Is it an option if there
it
is an ulcer?
It is an option. Usually with the varicose eczema, though, what you're looking to do is, you're moisturizing soaks with your hydromol, that's that regime, because usually it's hydration you want, then you want moisturizer. If there's a lot of varicose eczema, you'll need a little bit of steroid, something like Betnavate diluted if you can get it, or down on the leg. And the big thing there is they'll need to go into compression. So that's compression stockings or compression bandaging.
Yeah, and we'd use all that. I just never thought about the Milton.
Yeah, some places are doing it all right. It wouldn't, for varicose eczema, it wouldn't be the be all and end all. You won't be particularly kind of, it's not going to change it unless they're getting a lot of infected eczema. We use potassium permanganate soaks as well, like for that group where they're getting kind of.
Yeah.
But it could be.
Okay, I'll give it a go.
It could be.
Sorry, do you have any like recommendations on soaps, hand soaps to use? Like if you were going into work and you have to keep washing your hands all the time.
Yeah, that's a difficult one. Really, I suppose the ELAV range, they don't have a hand soap, but they have, you know, a kind of a portable kind of hand wash that does it, that would be kind of would be your kind of best one there type thing is. But there isn't a handy bar of soap that you can kind of you know, get. It's kind of been a neglected part of it, because I see that within healthcare as well. You know, we'd have a lot of kind of medical staff that's allergic to the hand washes and what do they use, but there isn't that good options there. And where you're stuck that way, kind of having a little bit of portable moisturizer helps. Yeah. So if you don't have, you know, a kind of where you have to use soap or whatever, is you need to compensate with moisturizer. But explore the ELAV wash there to see if you have something there that's a bit portable for you to carry. But it is a hard one.
Trying to
sports,
try to keep on top of the flare-ups, because of obviously gets very warm.
Yeah.
And then we do the washing, and then we do the moisturising, and then there's the stinging, and it's just can be tough going.
Yeah.
He loves his sports.
Yeah,
and
I don't know.
him,
Yeah, that's a real challenge. Sometimes I found the thermal water sprays you can get. So basically, it's cold water in a can, a vendo it, but you could mimic the same thing that spritzing with cold water after the exercise helps.
And anything for prevention. This is a little bit awkward, but you know, in his private area, behind his ears, just really awkward places.
Yeah.
We're constantly trying to keep, you know, cool and soothe it for him, but it just seems to be a constant battle.
Yeah. There's the cooling. Now there's actually there's a spray and go by Relizima. It's a zinc. It's like Sudocrem in a zinc, but it's good. It goes on quite cold, and on the groin area there, it's quite cooling. So to be worth trying a bit of that there to see if that would kind of help, because it's all about cooling the areas, and maybe having change of clothing. So he'd do a full change of clothing after there as a preventer. A little bit of paraffin gel there too before sporting out. It's greasier, but it'll give you kind of, it's a good repellent, so it'll help lubricate there, especially if he's cracking. Do you know that is kind of a nice recovery, and just say a thin smear before setting out would help as well.
Great. Thank you.
Yeah. Okay, great. Okay. Well, we call this session to an end, so thank you.